Hello everyone, welcome to my research channel. This is Tian. I'm a third-year PhD student in biostatistics here at University of Michigan, and this is my fifth year overall here in Ann Arbor because I also finished my 2-year master's here in our department. So there's two parts of my research. One is my graduate student research assistant work, and the other is my dissertation. So I will start with my GSRA. I had 3-year collaboration with Pulmonary Division in University of Michigan Medical School. Recently, we are studying the concordance and discordance relationship between the visual results read by the radiologist and versus the quantitative results from the CT scan. And other than that, we always interested in different respiratory disease states in COPD, which is the chronic obstruction pulmonary disease. We focus on identifying risk factors and understanding the trajectory of disease progression in smokers. So this is one of my old pictures drawn by hand, and it ended up with the plot on the right, which was in the paper. So yes, this was the times when people still use pen to draw pictures. These are my wonderful collaborators and also my GSRA advisor, Susan. And another big part of my research is my dissertation. My dissertation focused on incorporating external information to the internal study in the disease risk prediction. My dissertation is co-advised by these two wonderful professors in our department, Dr. Jeremy Taylor and Bamar Mukherjee. I will explain a little bit more about my dissertation work. There are three main key elements in my dissertation title: statistical methods to incorporate external summary level information into a current study. Let's start. What is external summary level information? So we assume there's a well-established disease prediction model that has been built on a large population. This model uses some commonly available access to predict the outcome of interest Y. So we do not have access to the individual level data of this model, but instead this has been built to a risk calculator online, such that patients can easily get access to this online calculator to calculate their risk of this kind of disease. For example, this prostate cancer prevention trial risk calculator uses age biopsy information to predict the risk of having prostate cancer for men age over 55. And this is our definition of external summary level information. Now, what is current study? With the development of biomedical science, we identify more and more new biomarkers that we believe will be highly predictive to the outcome of Y. So we'd like to build an expanded model using both X and B to predict the risk of Y. For that, we collected a small sample size, the data on individual level patients. But because of the sample size is small, we'd like to incorporate the information from the risk calculator that I mentioned before. So my work focused on to develop the statistical methods to combine both the individual level data we have in the current study as well as the risk calculator online. We developed a synthetic data method, basically transfer the risk calculator information into the synthetic patient level data, then combined with your internal data. And in the other work, we developed a meta-analysis approach to weighted average the multiple risk calculator information in order to utilize the information from all the available risk calculators. So there are ups and downs in research. In the research, sometimes you spend weeks or months to derive some formulas, and at the end you found you could have solved it last year. There's also some sweet moments when your reader emailed you they want to implement your method after reading your paper, and also some sweet moments when you were awarded the Chocolate Nobel Prize from your advisors. So welcome aboard, new students. Hope to see you all soon in the Ann Arbor